Good afternoon, everyone, and welcome to today's healthcare announcement. Bon après-midi, tout le monde.
Good afternoon, everyone, and welcome to today's healthcare announcement.
In the following order are the Honorable Susan Holt, Premier of New Brunswick, the Honorable John Dornan, Minister of Health, and Dr. Lise Bébin, President of the New Brunswick Medical Society. Les porte-parole aujourd'hui.
This morning's speakers in the following order are the Honorable Susan Holt, Premier of New Brunswick, Honorable John Dornan, Minister of Health, and Dr. Lise Bébin, President of the New Brunswick Medical Society. Before I turn things over to Premier Holt, I would like to ask everyone to ensure their microphones are placed on mute. There will also be graphics today that will not be visible in the interpreted versions in French and English.
Everyone have their microphones placed on mute. Today's live stream will include graphics that are only visible on the English and French interpreted versions. To view the graphics online, please switch to one of those feeds. Premier.
Thank you very much. I am proud to be here today to announce that we have concluded a 4-year new agreement with the New Brunswick Medical Society, representing an estimated $270 million of contribution to physicians. This new agreement will increase your access to doctors. Je suis fière d'être ici aujourd'hui.
I am proud to be here today to announce that our government concluded a new 4-year agreement with the New Brunswick Medical Society that represents a contribution of about $270 million for physicians. This agreement will improve your access to physicians.
2,000 physicians working in New Brunswick, and with it, we are delivering on our promise to improve the compensation model for doctors and primary care providers. Cette entente couvrira plus que 2,000.
This agreement will cover over 2,000 physicians who work here in New Brunswick, and today we are keeping our promise of improving the compensation models here for physicians.
Number one priority is healthcare. We outlined metrics that we wanted to achieve in improving care for New Brunswickers last January, and they were moving the needle on attachment to a primary care provider for New Brunswickers and increasing your access to a primary care provider within 5 days. This agreement will help us achieve the targets that we have laid out last January in terms of improving those attachment rates year over year from here through to 2028 and improving the timely delivery of care to New Brunswickers. We are caring for the people who care for us with this agreement. We're going to rebuild and modernize our primary care system. And so this represents a foundation for how we bring a new model of primary care forward. It shifts the way that we deliver primary care. On va reconstruire puis
We will modernize our system, and this agreement is the essential foundation for this change. And we're moving the needle on our promises and on the way that we are offering the access to primary health care and offering health care within 5 days.
Establish 30 collaborative care clinics close to home for you. And it describes a new compensation model that rewards physicians for patient attachment, for timely access, and for team-based practice. Cet modèle, ça représente une base de changement de la façon dont nous...
This is a change of the way that we offer primary care. This is a team model, and we are supporting our commitment on creating 30 collaborative healthcare clinics. This model compensates physicians for are attaching more patients and teamwork.
Doctors' flexibility while still moving the system toward team-based care. This model includes 3 options. Physicians can continue a solo practice should they choose. They are incentivized to move towards group-based practices, and they are further incentivized to adopt the best practice of collaborative care here in New Brunswick. We're going to be tracking the success of this agreement through accountability measures. These are really important for this kind of investment. We are going to be measuring that New Brunswickers get access within 5 days. We are going to be measuring and tracking patient attachment to make sure that you are finding a family health team and getting access to that primary care. And we are going to be measuring the continuity of care across this team of professionals that will be serving you. Alors, cette modèle, c'est quelque chose vraiment flexible.
This model is really flexible. We give choices and options, and this is one of the reasons why New Brunswick will become the place where primary healthcare providers will want to come and practice, thanks to this flexibility and the incentives. You can keep working solo. We give you incentives to practice in a team, and there are more incentives for collaborative healthcare, and we will be following up on this success through indicators. We will follow how many patients are attached to the teams and to the clinics, and we will keep following up on all those measures.
Community-driven care. It will help us accelerate the shift towards what we know to be the model that physicians and patients like best. Collaborative care clinics are going to receive new interdisciplinary care coordination fees. It'll be $15 per rostered patient for the coordination of that care amongst multiple health professionals. This agreement also includes requirements for shared electronic medical records, cross-coverage, and that coordinated care that supports team-based practices. We are working hard to align the entire healthcare system under this new collaborative care model. This shared approach will result in better service for patients and fewer visits to the emergency department. It's going to make our care primary, preventative, upfront, and in community, and we're going to reduce cases of New Brunswickers getting sicker and ending up needing urgent or acute care. Nous travaillons fort pour aligner l'ensemble du système de santé sur cette nouvelle modèle de soins collaboratifs.
We are working hard towards this collaborative approach. These clinics will get fees for interdisciplinary coordination of $15 per patient. The requirements related to the EMRs and coordination of care will support this team practice.
Our commitment to improving compensation models for care and caring for the people who care for us. This accelerates our ability to improve access to primary care within 5 days. I want to thank the New Brunswick Medical Society and Dr. Lise Babin and her team for working with us to deliver on this promise and for this transformative agreement for New Brunswickers that will improve their access to doctors and primary care. And I want to thank you for your continued care for New Brunswickers. Je veux vous remercier. À toi puis à la Société médicale.
I want to thank you and the New Brunswick Medical Society and your whole team. You worked really hard with us to fulfill this promise of improving access to care. Thank you very much.
Chaque personne au Nouveau-Brunswick a la
Everybody in New Brunswick deserves to have access to the care they need close to home.
has been tackling healthcare shortages, supporting recruitment and retention efforts, and creating workplaces where people feel respected, valued, and safe. And we're seeing results. Every day, people come up to us and say, well, I just got a family doctor. I'm now part of a team. up until now, and people still do come to us needing physicians, but the tide is changing. Since October 2024, hiring by the 2 regional health authorities has resulted in a net increase in 84 permanent physicians, 214 registered nurses, and 211 licensed practical nurses for over 215 new nurses in this province. This, of course, is great news, but we know the work is not finished, and we know our situation in New Brunswick is not unique. Our solution is. Healthcare workers are the backbone of our healthcare system. La communauté au Canada est
Communities across Canada and around the world need more healthcare workers, which means it's important that we are able to compete on the national stage.
The world need more healthcare workers, which means it's important that we are competitive and lead on the national stage. And competitiveness isn't just about money. Today we're talking dollars and cents, but the devil's in the details. We had a great negotiating team, Eric Levesque, Andre Robichaud, and Michelle Logier, who coordinated our desires, our needs, our working with the Medical Society's team. That's why this agreement also includes investment in physician wellness as part of total remuneration packages. When I was with the Medical Society, I would go to their town hall meetings, and I heard time after time after time, family doctors getting up to the mic and say, it's not the money, we need to be competitive, but it's a quality of life, and this agreement addresses that. Examples include enhancement of parental leave benefits and a new coverage for pregnancy loss, an increase in on-call rates, and this is what Premier Holt promised, reward people that stick around longer to look after patient needs. Across the board, and more funding for their wellness program. C'est vraiment un exemple de la...
This is an example of how we take care of those who care for us.
Health plan. We will continue to work with our partners to ensure that we have a strong and sustainable healthcare system now and in the future. This new agreement will help us with our recruits to recruit, retain new talent to get New Brunswickers the care they need and when they need it. The worst spent healthcare dollar is in the treatment of disease. The best spent healthcare dollar is to see people before they become ill, to give preventative care so they do not need to go to the emergency department. This is clearly less expensive than the alternative, treating people when they are sick. This is our prescription for New Brunswickers. Together with this collaborative agreement, our work with nurses, our work with our nurse practitioners, this will help New Brunswickers so that everybody is attached. You know, we've set short-term goals of attachment, but at the end of the day, we feel that this plan is progressive and will continue well into the future until every New Brunswicker is attached. Thank you very much, and I'll hand things over to my friend and colleague, Dr. Bebin.
Thank you, Minister Dornan. Thank you, and thank you for being here today. As was said, I'm Dr. Lise Babin. I'm president of the New Brunswick Medical Society, but I'm also very happy today to say that I'm a family physician working in New Brunswick in a collaborative care clinic. We are very pleased to have ratified a new physician services agreement with the province. This new 4-year agreement represents a landmark investment that will strengthen our healthcare system and provide much-needed support for physicians and their patients. Cette entente représente un investissement.
This agreement represents a major investment that will strengthen our healthcare system.
Addressed, and we are pleased to set the stage for a deep transformation of primary care while still ensuring our payment models remain competitive, that we help stabilize our hospitals, increase technology adoption, reduce administrative burden for our physicians, invest in health and wellness, and improve access to care in our rural communities. This new agreement allows
Ce nouvel accord nous
in terms of physician earnings. Given the ongoing health human resources shortage, being competitive with the rest of the country is critical to retaining and recruiting physicians. We were the last province, except for Quebec, to renew our physician services agreement, and we were sitting far behind our peers. We are now where we should be and will be an appealing destination for physicians from across the country and around the world.
We are confident that this agreement will make New Brunswick a great place to practice medicine. We expect to see a major transformation in the delivery of primary care in New Brunswick due to new payment models that have been developed by family physicians with investments in clinics and care teams. This will allow physicians to increase their patient load more quickly.
There will be three payment models for primary care, in addition to the current salaried option. Dorénavant, il y aura
Moving forward, there will be 3 payment models for primary care in addition to the current salaried option.
That every single fee-for-service family physician in our province will now receive a portion of their earnings through a capitation model. Tous les médecins de famille vont recevoir une portion.
All family physicians will receive a portion of their income through a capitation model.
Patients, and that amount will vary based on the complexity of care to ensure that no one just takes simpler, low-complexity patients. In our first option, we have created a solo practice model, which is meant to ensure we continue to support and retain some of our experienced physicians that are still providing great access and attachment, but might not be at a point in their lives and career where they're prepared to make drastic changes. This might also apply to some smaller, more isolated clinics where it is difficult to partner with other providers. Ce modèle va permettre.
This model will allow doctors in private practice to continue. There will be no obligation to join a team, but they will be rewarded if they increase their patient base, offer after-hour services, use nursing services, and also for using electronic medical records.
Designed for those who want to work as a group of primary care providers but are reluctant to commit to the full collaborative care model, we will provide increased funding for their patients in exchange for regular reporting on their levels of access and other measures of patient care. For the first time, we will be providing our physicians monthly reports on their performance to help them understand where they stand against their peers and support them in improving their practices and clinics.
And finally, we have the collaborative care clinic compensation model.
Clinic compensation model, which is the future of primary care. We will be encouraging the creation of interdisciplinary teams inclusive of nursing and allied health professionals. Nous encouragerons le développement d'équipes.
We will encourage the development of interdisciplinary teams that include nursing and other health professionals.
Packages on top of physicians' remuneration and will be tied to accountability agreements with patient attachment and timely access targets. Under this agreement, those family medicine specialists in New Brunswick who choose to work in teams and collaborative care clinics will have access to one of the best primary care investment packages in Canada. We recognize this is a milestone investment for the province and appreciate that the government has acknowledged the need for us to catch up and keep up with the rest of the country if we are to meaningfully improve our health system. The New Brunswick Medical Society looks forward to working with Premier Holt, Minister Dornan, and the Department of Health to implement various components of this agreement in the weeks and months to come. Thank you.
Merci beaucoup. I'd like to thank all our podium speakers. Je tiens à remercier.
Thank you very much.
We'll now proceed with questions from members of the media. Each reporter will have one question and a follow-up. You have the right to pose your question in the official language of your choice. We will start off with questions pertaining to today's announcement. Nous allons maintenant procéder aux questions des journalistes. Chaque journaliste a un droit.
We will now proceed with questions from members of the media. Each reporter will have one question and one follow-up. You have the right to pose your question in the official language of your choice. we will start with questions specifically pertaining to today's announcement. Bobby Jean McKinnon, CBC.
Bobby Jean McKinnon, CBC.
Yes. Hello, can you hear me?
Perfectly.
Okay, great. Thank you. Premier Holt, you mentioned about how this will help you achieve the targets of moving the needle to attaching more patients and providing care within 5 days. Can you tell us more about, what specific targets doctors have to achieve within sort of what time frame, and if they don't, I mean, what sort of penalties are in place?
What I can speak to is the targets that we've set to get patients attached. So we have a goal of having 81% of New Brunswickers attached by the end of 2026. And this model that incentivizes attachment and that prioritizes attachment is one that will help us do that. There are supports that are being put in place, I think both through the Medical Society and at the Department of Health, as Dr. Lise Babin described, to work with physicians on that attachment rate. We know you can't add 2,000 patients overnight. You have to do it in increments, and you have to do it at a pace that your collaborative team can respond to so that each of those patients is getting the right care. And so depending on the makeup of the clinic and the makeup of the team and their mix of nurse practitioners and physicians and others will depend on the pace that we expect them to achieve within their clinic, which is why we have these support teams that will be coaching and holding accountable our collaborative care communities to get those patients attached. I don't know if my colleagues want to add.
I'd be glad to add on to that. Ours is a system of rewards, not penalties. And we found that penalizing physicians for not doing something just doesn't work. And so our system now will encourage physicians, nurse practitioners to take on more people because we've given them more time. They don't have to manage their overhead, their HR resources. And when they take on new patients in a quality way, the blended capitation model allows physicians to spend more time with patients rather than a one symptom per visit. And so we feel that this will set us apart. We are the first collaborative care system in the country that looks at different types of practitioners, fee-for-service practitioners as well as salary people. Most people that have looked at that have gone the salaried route. We recognize that that's not going to work for New Brunswickers or New Brunswick physicians, and so ours is unique. It will lead the country.
And I would just add that for the first time, we're actually going to be measuring it. And I think, not to penalize, I think the reason we're going to be getting our reports is to be able to improve. It's a quality improvement thing. So we're going to be getting these numbers, and we're going to have something to work with. We're going to have a baseline, and there's only improvement there. And I mean, I think just having the resources to see these patients where it's not always the family physician that sees the patient for every single thing they need to be seen. It can be the nurse, it can be a psychologist, it can be a social worker. So I think it just leaves us more time to see the patients that actually need to see a doctor. So I think everything is in place to help us be more efficient. So we just have to see how it's going to go.
I want to emphasize that point that Dr. Babin just made because accountability matters. And so our ability to get this data, to track attachment, to track the ability to be seen within 5 days as a patient means that we will see where teams are really making progress and attaching patients quickly and driving that access in less than 5 days. We can go to them and learn, what are you doing? How is this working? And then if we go over to a different team and see that their uptake isn't as quick, then we can engage with them and say, hey, have you tried what this other clinic is doing? Can we help you with this barrier? What thing is holding you up to get those patients attached? Because that's our ultimate goal. Every New Brunswicker should be attached to a collaborative care clinic and a primary care team. And then within that attachment, they have to have access. So this gives us that accountability tool to report on performance and to help improve the performance of places that maybe need that extra hands-on care and coaching, or maybe can benefit from learning from existing collaborative care practitioners that are doing it really well.
This week past, we were working with people at the Noreen Richard Clinic here in Fredericton that's been shy of a family doctor for a long while, and a nurse practitioner that was hanging on by by a string. And now we have 2 physicians from Quebec who are coming this week to visit us for the Noreen Richard Clinic, and 2 physicians from Western Canada to want to have a look at that clinic. So already this agreement is bearing fruit.
Thank you. Ms. McKinnon, a quick follow-up, please.
Yes, thank you. So I understand that the 270 million is over the 4 years of the contract, so that's about 67.5 a year, and it's retroactive to April 1st, but that no money was set aside in the 25-26 budget. So I'm wondering, why is that when we knew that the contract was coming due, and where will that money come from? What other services will have to be cut?
That's a great question, and I wish my colleague at the Minister of Finance was here to get into the specifics. So there had been an amount put in the budget for 25-26 that reflected status quo. Even though knowing that we were going to be negotiating something new and transformational, they couldn't guess at what that was, so they put a figure that represented some growth on past years. What we're going to see is an upfront cost of about $171.5 million within this fiscal year, and an incremental cost of about $4.5 million, so a total cumulative cost of $176 million to this fiscal year, such that the impacts to future fiscal years will be $12 million next year, $27 the year after that, and $39 million the year after that to make up the total. And I will also caution, the total is an estimated total because it will depend on uptake of the different models. Because there is choice to go solo, to go group-based, to go collaborative, and the compensation varies depending on those models, as we mentioned, with the interdisciplinary fee, with the different rates that are assigned for capitation depending on the patient and their conditions, that kind of thing. So these are our best estimates. There is a major investment up front, and then investments in the years to come to make sure that we are doing everything we can to be competitive, to catch up, to keep up, and to get New Brunswickers access to the primary care professionals and doctors that they deserve.
Thank you. Suzanne Lapointe, Global TV.
Hi, I'd like to ask about the accountability measures. Doctors in Quebec were really upset about the new accountability measures in that province. It's kind of driving them to practice in other provinces. So my question is, how are these accountability measures you're introducing in New Brunswick different from the ones in Quebec?
So the ones in Quebec, a fraction of your income was based on how many people you saw, and you had to meet that, either what it was today or with growth. Ours are different. We are giving physicians different opportunities to work like they are today, rewarding them for seeing more patients. And so at the end of the day, it's not saying you need to do X percentage more. It's here are offers that will encourage you, allow you to see more. And the other part of it is that nurse practitioners will bring people to the clinic that will contribute to those numbers that the clinic is seeing. So as I said earlier, we're working with attractiveness, working with honey rather than vinegar. And we've spoken to the Medical Society, and they like that approach. Any doctor that's approached us has said, yes, it makes sense to have an electronic medical record. That way, we can follow what we're doing. We can share the files with each other, with our nurse practitioners, and we will be able to help physicians understand where they are with respect to seeing people within 5 days. Our doctor said it's not enough just to capture patients, roster patients. We want to know that we're doing a good job. And so those that have signed with us already are saying, make sure, allow us to do it right, and then we'll bring on even more.
And I would just add, I mean, we're going to get these accountability measures, but they're not going to just say you're not reaching target, get out. They're going to say you're having difficulty reaching target right now. How can we help you to reach your targets? And the resources will be there to help us do that.
Thank you. Ms. Lapointe, a quick follow-up.
Yes, Minister Dornan, you mentioned that this was a very unique agreement. Can you explain a little bit more how this agreement is different from those in other provinces? And did you take some lessons from the physicians' agreement in other provinces? Did you glean and extract a little bit?
Yes, we did. Before we formed government, we had to present a plan that had been tried and was working. So I spoke with folks in Newfoundland where they had a collaborative care plan, primarily in the capital. And so we knew that. I read Jane Philpott's book, and I've spoken with Jane Philpott. And so we had some examples of what that might look like. And then we shared that with our team. How can we do something that perhaps is better than what we've seen out there? And a big difference was our attraction, our need to involve fee-for-service physicians. If we went just the salaried route, which exists in Scandinavian countries and other parts of the country, we'd be leaving a significant fraction of New Brunswick physicians off the table. And so we blended it so that, as was said by Dr. Babin, we have people that will stay in primary care by themselves, people that will group themselves as a group of doctors, and then the highest level would be people that group themselves as a doctor with nurse practitioners that take a higher capitation rate. And so we did look at others, and now other provinces are calling us to see what we're doing to get people on board from all sectors of the physician society.
And if I can just, Suzanne, I'd love to give credit to the team at the Department of Health, because we have members of this team that have done a phenomenal amount of evaluation and research. So long had we been tracking what they'd done in BC, but we've looked at research on all sorts of different models, on salaried, on fee-for-service in terms of what works best. And then the team, including Dr. Dornan, engaged very closely with the members of the Medical Society to say, what are doctors in New Brunswick living? What is their experience? What do they need and want to stay here and continue to practice here? So we built something both unique to our needs, taking some of the best bits of what we've learned from other places in Canada and around the world, and moved to a system that is blended, that is flexible, that provides options for healthcare professionals, but that incentivizes that interdisciplinary, collaborative care that is timely with a significant amount of attachment. And that was a lot of hard work by an incredible team of civil servants at the Department of Health, the amazing team at the Medical Society, and the doctors that contributed to these discussions over the last many, many months, so that we can build a really unique program here, and we can confidently say that this will be the most attractive environment for primary care in Canada.
Nick Moore, CTV.
Good afternoon. Dr. Babin, what's your true expectation for how many physicians might switch over to this collaborative care model under this, what's being announced today?
So I think we're expecting it to be progressive. I think there are already many family physicians working in this model, particularly in the Vitalité Health Network. And a lot of, as I was saying, like the solo practice, a lot of those that want to remain functioning in that model will be able to do that. We're hoping that they might see that how working in teams can be better, and we might get some of them to switch, and especially those that'll choose like the team-based model. I think they will eventually gravitate towards our collaborative care clinics, because the resources available with those models will just make our jobs so much easier. I think they'll naturally gravitate towards that.
And my quick follow-up for the Premier and the Minister, we're hearing a lot about Quebec. Do you have plans to take this new announcement today to other provinces to say, hey, this is what we have now, and we're competitive, in your own words? Thank you.
Well, our recruitment team has been working really hard to get the word out, because, as you may have heard, there were some folks that we've been recruiting and negotiating with that were waiting to see what agreement would land with our physicians in the province. And now that they've seen it, I think there's two benefits that we're observing. One is that some of those people we are courting are now saying yes. Some of them are coming from Quebec, some of them are coming from the US and other provinces, because we have long been reaching out everywhere to address our shortage of healthcare professionals. And so now we have the answers to some of the questions they've been asking us. And I am looking forward to seeing a number of those new agreements of people who had been waiting to see the details of this deal. We'll see how great it is, and we'll sign on. And if I can just share a quick story from yesterday, I was over at the Fredericton Chamber of Commerce luncheon, and a gentleman came up to me whose wife is a physician, and said, listen, we were looking to move. We had already started shopping places outside of the province, but with this agreement, we're going to stay. in Fredericton and in New Brunswick for the long term. And so this is a tool both for the retention of our current physicians and the recruitment of new members to New Brunswick from neighboring provinces and other countries.
So I'd add a little bit. I had an opportunity to speak to the Minister of Health from Quebec, and he had two items. Turn down the heat, please. Don't send out your full team out here. And I had to explain to him, we already have people in Quebec, in the US, around the world, every other province, so we won't increase it, we won't turn it down, but our efforts are bearing fruit. And the second thing he wanted to know is, what are you doing differently? How are you bringing in a contract that has, I won't give the number, but a very high satisfaction rate amongst the physicians in the medical society? We were significantly behind, 15% behind specialists in this country, 20% behind primary care. So now we've caught up, but it's not just the dollars, it's the type of practice. So we are getting calls on how we are going to do it, how we've done it. It was unique to look at both groups of physicians, salary and fee-for-service, and so people want to hear how we do it. And my hope is at some point in time, other people will come to that, but we're there first.
Thank you. Alexandre Boudreau, Acadie Nouvelle.
Merci.
Thank you. Could you give us an idea of the amount of incentives for the things that you mentioned? For example, the physicians who join a team, who are open after hours, and so on. And I believe, Premier Holt, that it is mandatory to use EMRs. So is it mandatory, or is it just gives you an incentive? Or if it's mandatory, why is there an incentive? It is mandatory for the collaborative clinics, so for that third model. And then there are incentives for EMRs. It is very important to have access to the tools for, it's not accounting, what is the word? Accountability. So it is very important, and EMRs really help know what the performance is for the teams, but it is not mandatory for a solo clinician. There are no incentives there. So this is what the model is like. EMRs are essential when you work as a team because everybody put the documentation on the same file, so it's easier when you are looking for information, and that's why it is essential for collaborative care clinics. So what are the amounts of the incentives for all this? We can mention a few of them. So I mentioned the $15 per patient for an interdisciplinary team. The capitation amount, this changes according to the age and gender. I believe it's $62.90. Well, it depends on the compensation model. And the more collaboration there is, it increases the amounts. There are a lot of details in this agreement, as you can imagine. So right now, lawyers are reading it before we sign it in a few months. So there will be more communication so that we get into more details. We didn't want to inundate you with every portion of every chapter of this agreement. That would be too much, even for me to remember every element. So we will come back to explain the benefits of this in this portion and the benefits in the coming days. Well, I don't feel inundated.
Solar practitioners, they get paid per person they see. There's an enhanced capitation rate for groups of physicians that work in a team and have a electronic medical record. And then there's a further enhancement in the rate for physicians that work in a collaborative care team. So all the way along, they are rewarded for seeing people, but rewarded more if you see them in the context of a collaborative care team.
Donc, c'est environ 270 millions. J'aimerais pouvoir comparer.
So it is an extra 270 million. I would like to compare. What was the last agreement? 82? I think it was 82. Alex Villeneuve, Radio-Canada. So just to follow up, we know that the public finances are in deficit. Can New Brunswick pay and double or even triple? So if you said 90 million, can we triple the agreement with the doctors? Yes, I believe it is necessary to make these investments in the healthcare of New Brunswickers and in prevention. The population does not have access to healthcare, primary healthcare, and then they get to the ER. So if we do not make these investments now, the costs will increase in a way that we will not be able to afford. And we are always looking at the bottom line to see if it's possible. And this is why we are comparing what is being done. We're looking at our net debt, our GDP per capita. I believe we have the third best net debt to GDP ratio in the country. So we are in a situation that we can manage, that is responsible, and we are making investments today to lower the cost to more. This is something that governments have not done for decades. So they're not making the investments, so it costs more and more after, because we have too many New Brunswickers who go to the ER where it costs a lot more than it would in a primary care setting. So with prevention, we could avoid all those costs. So we will be investing in the health of New Brunswickers. This is a personal investment and an economic investment, because we cannot have a healthy economy without having a healthy workforce. So it is time, well, really yesterday was the time. We needed to catch up because we were losing doctors, and we have people who need to be cared for here. So our government will make these major and transformational investments so that our young people don't have to pay for the increasing costs in the future. So maybe correct me if I'm wrong, but if we go from 90 million to 270 million, so are we tripling the compensation of doctors? You're saying no, but do you feel that like this was easier for you to make these gains because of the Quebec context? I don't think that Quebec had any influence on the results of the negotiation. As for the increase of compensation with physicians, there was a lot of catch-up to do, like Minister Dornan said. I believe it was 15% for specialists and 20% for family doctors. So a part of those amounts are the catch-up, and then we have the annual increases. So nobody would see their salaries triple.
We didn't triple physicians' income. What we did was we tripled the amount that we've added on this year.
Thank you. Just for further clarity for reporters in the room. The 270 is the increase, and the 80 that was referenced was the last increase. So your base denominator is the Medicare budget. So public accounts would have that number for you. That's what you add to with those two numbers, just so we're clear. So there's not a tripling; it's a larger increase.
John.
René, merci. Parce que le salaire des médecins n'ont pas triplé.
No, physicians' salary did not triple. No, we said 15% or 20% to be competitive and with the model of capitation and accountability. So this is a 15% or 20% on a large budget.
All right. Okay. Just checking.
That's correct.
So I realize it's hard to say how much this will cost because it's based on estimates, but if everything goes according to plan and the way you want, how likely is it that our deficit will go over $1 billion this year?
Well, the deficit for this year versus the uptake of this plan, that's a pretty tight time frame, right? The investments that are going into this budget year will take us back to April of 2025 and then carry out through to March of 2025. And I mentioned that the impact cumulatively on this year's budget is $176 million. So we are hard at work on finding ways to decrease the cost to deliver services for New Brunswickers, to find efficiencies, to stop doing things that aren't serving us, because our objective is to have the lowest possible deficit while making the investments in the things that are going to decrease our costs in the future. So that's what we're doing, and this agreement is something that we're going to factor in to, well, obviously future years as well as this year, as we continue to look at every possible opportunity for savings and efficiency.
Okay, so you won't say on the billion.
Well, we can't. I mean, you've seen a Q2 projection, and there'll be a Q3 projection, and then a Q4 projection. The economy moves. We're pessimistic about the direction the economy is moving in right now and how that's going to affect future forecasts, but we're doing things to drive economic growth. We're doing things to decrease the curve on the spending side, and our goal is to have the lowest possible deficit. But I can't sit here and promise you what it will or won't be in the future. That's hypothetical. I will tell you we're doing the work. We're looking at it very closely, every penny, and we're investing dollars where New Brunswickers are going to benefit, and that's what this investment is. This new agreement with doctors is an investment in New Brunswickers, and it's going to give them access to more doctors.
Just my follow-up here. You know, with any negotiations, give and take, obviously you don't want to give doctors everything, it'd be too expensive. So where do you feel like you did that give and take? Where did you feel like you had to make concessions?
So I'll answer that because, you know, for example, requiring an electronic medical record, that's a big undertaking for physicians. And we agreed that we would pay for that, make it more palatable. And so that was something that we gave on. We allowed for reimbursement for that to encourage physicians to participate in this for a collaborative care and for the groups of physicians. You know, I'm not sure. The Medical Society agreed this year the emphasis was going to be on primary care. And in other years, it's been balanced between primary care and specialty care. And to the Society's credit, they recognize that we have a crisis in primary care. So I'd say they were supportive of our putting significant resources to primary care, to collaborative care teams. So I think that's just a description of some of the give and take that occurred. Dr. Babin, did you?
I don't think I have anything to add to that.
Perfect. We're going to go to Brian Tate with Acadia Broadcasting.
Thank you. It sounds like this collaborative model is being pushed pretty hard. That's where we'd like to get to down the road. I'm wondering if there's any concern that with that model, we might see more health professionals move to the population centers of the province as opposed to rural areas. And I'm wondering if there's any plan to kind of avoid that, to keep them away from only St. John, Moncton, Fredericton.
I appreciate that concern very much because we want to make sure that every New Brunswicker, no matter where they are, is getting served by healthcare professionals, and that this does support every community, not just urban ones. So there is some more information and more detail about how this will encourage and support healthcare delivery in rural areas, and that's information that we'll share in the weeks ahead, because that was something that was top of mind for us, is making sure that we had an equitable distribution and incentives to make sure that we were getting doctors in every corner of the province.
So if you call some of the announced clinics that we've announced, they have not been exclusively urban areas. You know, Isabelle-sur-Mer, a very nice clinic, rural New Brunswick. We've established clinics in Campbellton, which is a new clinic. We are looking very positively towards a community-based clinic in Hampton. And so our plan, our collaborative care does work in rural areas, and it does not necessitate that all the physicians be in one building. Some of the clinics that we've seen, people are in buildings that they've occupied for a long time, but with an electronic medical record, they work together. On Wednesday night, you might go to address A. On Tuesday night, if you have needs after hours, you might go to address C.
Mr. Tate, do you have a follow-up?
Just in terms of that, as far as recruitment goes, is the plan to focus generally on just healthcare professionals, or is there going to be a focus on a specific area like new doctors, new nurse practitioners, specialists?
Well, as my colleagues have talked about, this is certainly a primary care focused agreement that also helps us catch up for specialists. Much of our focus, my colleague Minister Dornan and I, has been on primary care, getting ahead of the problem and focusing on nurse practitioners, social workers, the LPNs and RNs, the physiotherapists, the pharmacists, all of the pieces that surround and are part of a collaborative care model. And so that's why you would have seen announcements that we've made about ensuring that we have seats and training programs for those allied healthcare professionals. That's why we're advancing scopes of practice and payment models for nurse practitioners, because we want to get primary care right everywhere.
We want to get specialty care. We're not ignorant. We've announced hybrid ORs in Fredericton and St. John that will bring in specialists in multiple different disciplines, you know, an attraction tool that wasn't there previously. So we are not ignoring the contract. The agreement does look at specialists as well. And I think specialists are supportive of that, and we continue to grow our specialty numbers. So those 82 that I mentioned earlier today, significant fraction was primary care, and a significant fraction was specialty care as well.
Thank you, Mr. Tate. Avant de terminer, before we close, I'll turn things over to the Premier.
Thanks very much. I want to reiterate my appreciation for the team of people that worked very hard over very many months at the Department of Health, at the New Brunswick Medical Society, to make sure that we had a good, fair agreement that drives what New Brunswickers deserve: access to primary care in their community from a team of people who will provide them with the right care at the right time. This is a transformational agreement that puts New Brunswick at the front of the pack and makes this the most attractive jurisdiction to deliver primary care in Canada. With it, we are going to give you access to doctors. We're going to improve your access to care, your attachment to family care, and the time in which you can get an appointment. Pour nous autres, c'est un investissement.
To us, it is a major investment that will be transformational. It is an investment in New Brunswickers and in their access to primary care, to family physicians, with the best model, attractive model in Canada, where we can practice medicine in a flexible manner. That this is the foundation for the changes to come, where New Brunswick is a place where you can live in good health.
Work and how we've laid the foundation for New Brunswick to be the province where you can live well here. So I want to thank everyone for their efforts. I want to thank you for being here today, and we look forward to seeing the fruit of this labor come to bear in the coming weeks and years. Thank you.
Merci beaucoup. That concludes today's press conference. Merci.